Welcome to the Spotlight Series. I'm your host, Scott Nerney. Don't forget to subscribe, share this video. This is one of the most important videos that you'll see this month. Jamie Sanford is here from Linn Health and Rehabilitative Services. Welcome to the Spotlight Series.
Thank you, Scott.
We really want to talk about what your organization is doing and what the needs are. But first, tell our listeners and viewers a little bit about yourself.
Thank you. Well, my name is Jamie Sanford. I am a native Rhode Islander. I am the administrator at Linn Health and Rehabilitation, a nursing home of Aldersbridge communities. I, for the last 17 years, have been providing services and support to Rhode Island elders, starting my career as a medical social worker and more recently, as of 2020, as the administrator of our nursing home.
And where is the nursing home located?
We are located in East Providence. It's Aldersbridge communities. We've been around for 50 years.
Wow.
We provide affordable housing, affordable assisted living, skilled nursing care, rehabilitation services, outpatient rehab, and navigator services, which is a care manager resource for older adults in Rhode Island. And in 1978, Aldersbridge communities expanded their services, opening up Linn Health and Rehabilitation, which is a skilled nursing home and long-term care community. And that is the building that I run.
So you're taking a little bit of folks who are getting on in years, working with them, working on programs. One of the things that I think a lot of people forget a little bit about with nursing home is that catchphrase of nursing home is the last stop, but you do a lot of rehabilitative work with people that may have recently had surgeries or issues and were hospitalized.
Yes, absolutely. So we serve a large population, those who require help after recovery, when they're in recovery, after illness, injury, surgery. We provide physical therapy, occupational therapy, speech therapy, social services to help navigate individuals through that process. We offer activities and recreation services and nutritional consultation. We have a specialty program for Parkinson's and movement disorders. We partnered with the Parkinson's Foundation to educate all of our staff, so housekeeping all the way up to administration. All of us are educated on how to provide the best care to those with Parkinson's and movement disorder, and to be resources to their family. We have 4 therapists certified in LSVT, which is a Parkinson's therapy approach to improve the overall well-being and function of all those living with Parkinson's.
Wow. There's not a lot of facilities that go to that extreme.
No.
That's
And
great.
we're very proud of our programming.
How many overall residents do you have?
Currently, we are the home of 71 residents, and we employ 155 very dedicated staff.
Wow.
Yes.
That's fantastic. And everyone from CNAs to nursing to rehabilitative, you mentioned.
Yes, a number of departments. We have CNAs, certified medication technicians, LPNs, nurses, dietary staff, activities, social services, administration, therapy staff, business office staff, and dietitians.
So what's the average stay for someone? Let's break it into 2 pieces.
Sure.
Say for a rehabilitative setting, what's the average stay? I know it can be different based upon why they came in, but
It certainly varies, but your average short-term stay is around 14 to 20, 24 days.
okay.
Yep.
And they're progressing through different levels as you're working with them?
Correct. And what is unique about Linn is we provide services on a short-term basis, but we also opened up last October an outpatient rehab therapy.
Wow.
So our residents who discharge back home successfully to the community that still require a little bit of in-home rehab can actually come back to Linn and work with the therapist that they have grown to be comfortable with, have formed relationships with, and it's really meaningful opportunity.
And it keeps some of the costs down once insurance may not cover so much.
Correct.
And what's the average stay for, say, a nursing home patient?
Long-term care patient.
Sure.
You know, your average stay, again, it varies. We have residents, actually, one of our residents just turned 104, and she
Wow.
has been with us for over 15 years. Um, but they range typically around maybe 5 to 8 years. They can stay
Okay.
with us.
So I
So
know a few decades ago when long-term care insurance was a popular thing,
mhm,
the quotes that a lot of companies used was, well, it's like 2.5 years in a facility is all you'll need.
mhm,
And it's not that way anymore with medicine progressing and people living longer to start with. That combination and far better care than what it used to be.
yeah, and I truly believe it's related to the care. You know, we give our residents a sense of community and a sense of purpose, and each of their daily activities are really designed around their likes and their dislikes and what makes them happy, and that makes a difference.
Okay. So that's all the great stuff.
Mhm.
Let's talk about the troubled waters that we're currently in with
Sure.
long-term care in itself. Years ago, it was a lot of private pay. It was more fully funded Medicare and,
Right.
in Rhode Island, Medicaid.
Right.
So let's talk about, you contacted us, said you were looking for a Christmas
Sure.
miracle,
I was.
which is, I think, a poignant phrase to come out with.
Mhm.
Give us a little overview of what that looks like.
Sure. So about 20 years ago, when I became a social worker, I vowed every individual that I supported and served that I would be their voice. So I have decided to come on today and be the voice of not only my own residents, but the residents of nursing facilities across the United States. Currently, we're in crisis, all of us. Very tough situation financially. The increased costs that we've all experienced over the last several years have really had an impact. And it's resulted in hundreds of closures across the United States. More specifically, in Rhode Island, we've experienced 6 nursing facilities close their door permanently, and 3 are currently filing for bankruptcy. This is a serious problem.
And how did we get here? Is it inflation? Is it increased labor costs? Is it the pandemic that took a lot of workers, like many companies in healthcare, out of the loop?
Mhm.
Or is it a combination of a lot of different things?
You've hit the nail on the head. It's all of those things. So it's the staffing crisis. This is nothing new. It started pre-pandemic and was amplified pretty significantly during COVID. Individuals left the healthcare, and we are not seeing the volume of workers get into healthcare. So that has caused some critical situations financially for nursing facilities and hospitals, having to pay higher labor costs for staffing agencies to provide that quality of care for residents. Inflation, we've all experienced that at home. The utilities skyrocketed, cost of food, again, you know, cost of labor, cost of supplies have gone up. And the most important part is the reimbursement of Medicaid residents. Our reimbursement is not keeping up to that inflation cost or to even cover the cost of care. We did a little analysis in our home, and we found the average cost of a Medicaid resident is $411 a day. Our reimbursement is $255 per day. So we are losing hand over foot every day. And the population we serve, being a not-for-profit, we serve majority Medicaid residents. We can't survive like this.
And when we're talking about Medicaid patients, just so everybody's clear, the difference between Medicare and Medicaid,
Sure.
Medicare is not paying for nursing home care for very long.
Correct.
It's a short-term buffer until some arrangements are made.
Absolutely.
Medicaid is for someone who doesn't have a lot of funds. Literally in the few $1,000s, there's not a lot that they can tap into, and they're kind of at the mercy of a facility to take care of them, like yourself, or the state to place somebody.
Correct. So individuals that are on Medicaid, it's the medical insurance assistance that the state provides, and it's for individuals that have less than $4,000. Their cost of care is over $400 a day. So the state reimburses us the $255 a day, but there is such a growing gap between the rising costs that we're experiencing and the increased labor.
So two things people can do. One is to try to work with their legislative electors across the state, the House and the Senate and the governor's office, to ask, as you said, on behalf of all nursing homes,
Right.
to try to tell them nursing homes need some help and some love and some funds more than anything else to try to stay in business and serve our community.
Right, absolutely. And at Aldersbridge Community, all the leadership got together, and we formed this committee, and we're calling it the Hail Mary, because we're hoping for that Hail Mary pass. We've contacted legislation, the governors, different legislation officials, and state representative government decision makers. We've also met with the families, because our families say, how can we help? We don't want our loved one going anywhere else. We need them to be here with you. What can we do? And that's exactly what we're doing, is saying contact your local officials, make them aware of the current situation that nursing homes are experiencing, and ask the question, where are these residents going to go? Where are the Rhode Islanders going to go?
Jamie, I know we're going to be asking the folks out there watching this to help you and the legislatures, but even the residents are trying to pitch in. You had some stories when we were talking before the taping. Tell us a little bit about that.
So I have, as I said before, 71 just amazing residents. And when it came to light, the current situation that we were in, I knew I had to maintain the confidence and trust that they had in me. So I held a meeting with all the residents, and I described what we were up against. I was very nervous going into that. I didn't know what their responses were going to be. And that moment was humbling to me. And it will forever be in my heart, what I experienced that day. They did not say, I want to find another place to live. I don't feel safe here anymore. They said, how can I help? And they all started talking and said, we're going to do a bake sale. That's what we're going to do. We're going to help you raise money. We're here to support you as well. And that is exactly what they did. We had about 30 residents within different areas of the facility making pie crusts and pie fillings, and we made apple pie and pumpkin pie, and they set a goal of $1,000, and at the end of the bake sale we raised over $2,000, and it was so heartwarming for me to sit there and listen to them offer this, but also heartbreaking that they have to do this to keep their home.
And as more and more close or go bankrupt, the pressure on those that are still here is even greater.
Correct.
So it's not a short-term fiscal solution that we're looking at. Talk to our folks listening. You'll accept donations in kind. If people have things that they could bring you, financials, gifts, estate planning, anything along those lines, tell them what really could make a difference.
We are looking for charitable donations. We're looking for a Christmas miracle. So we're hoping for the generosity of anybody listening. If you believe in us, if this tugs at your heart as much as it tugs at mine, that you open your wallets and go to our website, www.aldersbridgecommunities.org, and click the donate button. You can contact us. Elise Strom is our Director of Development, and she'd be happy to talk to you and explore different ways you can help with fundraising, giving donations, or contacting legislation.
Right. Thank you so much.
Really
we're praying for you.
Thank you.
We're big fans of what you're doing out there. We want you to survive and be there for the folks who are watching this. This could be yourself or your parents, grandparents, maybe even your children in the future generations that really need facilities like this and facilities around the state to really make a difference and be there for us for tomorrow. Thank you so much.